Well, for the past 9 months, our healthcare professionals have strived to fight COVID every day, and it has reached all areas of our community. And we have celebrated with those who have recovered and mourned with those who have experienced loss. The number of cases in our community is rising quickly, and the hospital beds are filling up at an alarming rate. We've experienced a large number of patients that require prolonged hospitalization, and now is the time we have to take action.
And so it is a serious situation. You know, if it gets much worse, we're near capacity as far as being able to take care of patients that require a ventilator for treatment.
People need to be really cautious. This is very serious, and I think some people don't take it seriously, but it really is a serious situation.
Well, I think that what we're seeing is there's been a significant increase in the numbers here lately. The infection rates have gone up quite a bit. We've seen quite a bit more patient visits, both in the outpatient setting as well as in the hospital.
So we're trying to educate the public in making sure they wear their masks, social distance, wash the hands, that's very important, and try to stay out of large groups.
Since the onset of the pandemic, our school, Campbellsville University, went to work right away, putting together committees and beginning to acquire resources to help us through this pandemic and to equip others on our campus as well in our community to be able to combat the spread of the virus. So we've taken a lot of steps beginning with this fall semester, going to a very modified fall semester calendar where we shortened the calendar as much as we possibly could. We went to high flex type of campus class delivery where students would have some face-to-face but also virtual class experiences. We didn't have a fall break this past semester, again, to cut down on the opportunity for students and others to be able to travel and perhaps be exposed in other places. We've constantly monitored all of our activities as well as the spread of the virus on campus and in our community. And through that, when we felt it was necessary, we would pause different events or athletic competitions or practices. And so we've done a variety of things throughout the semester to, again, do the best that we can to minimize the spread of the virus.
What everybody needs to realize is that this is a really bad situation that we have. We're in the midst of a pandemic. Our numbers are going up. We have people that are dying from it. We have other people that aren't dying from it, but they're awfully sick from it. People that have gotten over it that never are going to get back to normal. So we need to be doing everything that we can to try to prevent transmission. So that includes wearing a mask, staying 6 feet apart, avoiding social gatherings, all the things that we've already talked about. So you can't just do one or the other, pick and choose. You need to do all of them.
It's a team effort. We all got to work together. And I think that as much as we possibly can, we should all respect these decisions, as hard as they may be, and try our best to comply with them, and particularly with social distancing, limiting gatherings, wearing masks, and those type of things.
As far as the symptoms of COVID goes, it's so incredibly variable from people that won't have any symptoms hardly at all to people that are deathly ill. And so the main symptoms that you look for, number one, is going to be fevers, chills, body aches. You can lose your taste and your smell. And that one's actually fairly predictive of somebody that has COVID. So if you lose your smell or your taste, I think you have about an 80% chance of actually having COVID at this point. And so it can be confusing because a lot of those symptoms are the same symptoms you would have with the flu. Now, in my experience with people that develop symptoms from COVID, they know it's something different and they feel pretty bad headache, bad fevers, horrible chills. But the bottom line is if you develop any of those symptoms, you need to go be tested, for COVID and possibly for flu as well.
Well, we're expecting to get some vaccine probably by the middle of this month. We don't know exactly how many we will get at first. They have told us the first people to be vaccinated are the frontline workers in healthcare, whether it be the nurses and doctors, the EMTs, the firefighters, those that are on the front line, and also those elderly people that have other sicknesses such as diabetes or things like that would jeopardize their health. Hopefully by the first of the year, we would be getting more vaccine and it would be rolled out to different areas in the community. It's not going to be a short process. I think it's going to go on for many months, but we're very encouraged by the results we're hearing about the vaccine.
And so if we can keep the numbers as low as we possibly can, and that really should be our strategy. Let's keep the numbers as low as we can until we can get the vaccine. Once we start vaccinating people, that's not going to be the end of it. It's still going to take months and months before we get to where we can start getting away from some of these measures as far as mask wearing and social distancing. But if we can keep the numbers down until we can start vaccinating people, we can vaccinate the high-risk people, the vulnerable population, and then hopefully we can minimize the impact of COVID-19 in this community.
On behalf of Campbellsville University, we want to thank our community and all the different entities within our community that have been very supportive to Campbellsville University throughout this pandemic. And as we move into the spring semester, Campbellsville University is committed once again to doing our very best to provide an academic experience for our students in as safe as we possibly can environment, and to comply with the recommendations that come from the CDC as well as from the state for the pandemic.
We want to thank the community for the support. There is a lot of healthcare workers here who are very tired and worn down, especially those that are working every day in the COVID unit. So we thank you for your support. Please don't be afraid to come get the help that you need. Just because you come to the ER, you're not going to be exposed to COVID. We take every precaution. In fact, the hospital is probably one of the safest places you can go. Everyone here is required to have their temperature taken every day. They are required to wear masks. They are required to wear eye shields when they're working with COVID patients and with other patients. So please, if you need care, do not delay care. Please come and let us take care of you. We want to take care of you. We are your hospital. We are your community, and we want everyone to get through this together.